Welcome to Learning Unit number 12. In this learning unit, we're looking at clinical preventive services and how these services are linked to promoting health and preventing disease. So we're also focusing on the U.S. Preventive Services Task Force and the CDC's Advisory Committee of Immunization Practices. And just make sure you know the abbreviations for each, with a look into screening recommendations and immunization schedules. So you're watching this video, and the learning outcomes are going to be apply the recommendations of the U.S. Preventive Services Task Force, specifically to patient care screening for prediabetes and diabetes mellitus type 2, so diabetes type 2. Discuss the ACIP vaccination schedules for children and adolescents, along with the vaccination schedule for adults, and complete an in-depth review of one vaccine across the age group. And you're going to be able to describe how clinical preventive services are linked to promoting health and preventing disease. Let's keep moving on and to get to the specific readings. So it's chapter 8 that you're reading, and it's a small or short amount of readings, page 201 to 211, and then just page 216. For those of you with ebooks, it's the beginning of chapter 8 through and including the information on promoting the use of preventive services, and then just the summary and key terms. So those are the readings. Then there is the ACIP recommendations. This comes from the CDC and the ACIP at a glance. Read through these three things here, but especially what they do. And then a little bit more of the overview. You're going to look through just that. You don't have to read the recent meeting recommendations, but you will have to click on immunization schedules. And this is in order to complete your discussion board. And then you'll see here's the immunization schedules for children and children and adolescents, and the adult ones. So you just click on there, and that will open it up further. And there's very specific directions about doing this in your discussion board. So please, you're going to look at that first before doing it. Then the USP STF recommendations for screening for prediabetes and diabetes, and you're going to need to expand all to do this. So when you click on this web link, this is indeed the U.S. Preventive Services Task Force. I just have the information, the header cut off, but it will open up and you'll see. And they talk about screening, and here's the recommendation. Here's the grade. You are familiar with this grading system. If not, go back to your midterm paper because you did include that. You can also see that on the website as well. But here is what you're going to be recommending, what providers are recommending. And then please make sure you hit expand all. All right, you have to hit expand all to see more of the specifics as far as the as what exactly you're going to be knowing that they're going to be ordering. This is what you want to look at. And I'm just trying to see through here because it's just kind of changed. Here's the screening, and here is some of the information you're really going to need to know about the tests for prediabetes and type 2 diabetes. Here are the tests that can be ordered. So that's one of the things I want you to focus on. And let's go back now. So we've gone through ACIP for the immunization schedules, the task force for prediabetes and diabetes. Here is information about A1C, also known as hemoglobin or HbA1c, testing for prediabetes and diabetes. And then here's your discussion board. So let's open that up a little bit. And again, answer these two questions. After reviewing either the adult immunization schedule or the child and adolescent immunization schedule that is on the ACIP website that is linked to the Blackboard that I just reviewed, share a summary of one vaccine for either adults or children, adolescent. So then you're looking at one specific vaccine. You're going to review the vaccine. You're going to review the information found within this, which is known as the legend. There's notes and other available information located within these schedules. So you're going to share a summary of that vaccine, including these. So in other words, what information about this vaccine do healthcare providers need to be aware of? And that's why you're going to look at the notes, the legends, the makeup of immunizations, if the child gets behind on immunizations for whatever reason. So that's going to be included in your summary. And then after viewing the task force recommendation statement on prediabetes and type 2 diabetes and the information found on the A1C, here is your case scenario. And you're going to answer this. What would you say to a 38-year-old patient who has a BMI of 30 and no symptoms of diabetes? And you should know the symptoms of diabetes, but excessive thirst, etc. So who has just seen their primary care provider, so they're in the office seeing their primary care provider, and you come in, you're the RN of the office, and you come in after the primary care provider has seen the patient and they had ordered an A1C lab test. So the patient's talking with you and says that they don't know why they need this lab test. Evidently, the primary provider forgot to alert them to it, or maybe they don't remember the information due to anxiety. But either way, they don't know why they need this lab test, and they don't even know what an A1C test is. They shared that, you know what, I'm probably not even going to go to the lab for this test. So coming back here, what would you say to this patient? Please make sure you're giving them plenty of good information about what screening is recommended, who recommends it, and what they need to know about the A1C lab test. Now, that's just one of the tests that can be ordered according to the task force. And you're going to make sure that you know all three of those tests. But please cite, again, both in text and your references per APA, information from the learning activities. You do not need to reply to a colleague, but I do hope you read a couple other posts. So no reply is required, and I hope that will allow you to continue your work on your group presentation, because that is due next week. And here is an optional source that maybe some of you will find helpful. It's on how you can prevent chronic diseases. So it may be good for your health promotion program because there's tip sheets and educational materials, etc., etc. So click on, see what's there. If it applies to your group, then you might want to look further. If not, you're done. It's an optional. So have a great week, and I really look forward to seeing your presentations. Thank you.